two, three.
Geriatric eggs and a man has good quality sperm, does that increase your chances of fertility?
Yes. And if a man
Okay.
is younger, also,
Okay.
because he has less DNA errors than older man
Okay.
with the
Okay.
same
Go
or
ahead then.
similar sperm. So the opposite is also true. So when
Okay.
couples are usually paired in age at the same age, their chances combined is less than if you have the opposite pairing, which is older woman with younger
Younger man.
man or vice versa.
Mm.
You see?
Wow.
And
Okay.
so that's definitely going to make a difference. And that's also part of why, in nature you see these kinds of pairings sometimes where you have, an older man, younger woman kind of situation that goes on. These
Mhm.
days we're seeing the opposite, certainly a whole lot more.
Welcome back to the Transform Your Mind to Transform Your Life radio podcast and television show. I'm your host, life coach Myrna Young, and sitting in the guest chair today is Gabriela Rosa, fertility specialist. And Gabriela and I are going to be talking on the topic, what are the top causes of female infertility? Infertility has now become such a big topic. When I was in my childbearing age, women would be getting pregnant and they don't want to. And now it's just flipped the switch. Almost everyone is having some problems with infertility. It's no longer where you're finding somebody that says, "Oh, I just have to have sex once and I'm pregnant." That stuff has changed. So now we're having the infertility conversation. So I'm excited to get into this conversation with you, and share Gabriela's expertise on this. So welcome, Gabriela.
Thank you so much. Thank you for having me.
You're very welcome. All right, so let me give you guys a brief introduction. Gabriela Rosa is a fertility specialist, a reproductive health educator, and Harvard University awarded scholar. Gabriela created the world's first entirely virtual and holistic fertility clinic. As the founder and CEO of the Rosa Institute, which currently serves patients in every continent other than Antarctica, Gabrielle leads a team of holistic specialists. Her treatment methodology has become an authority in its industry for identifying and addressing biochemical obstacles that guide couples in overcoming infertility and recurrent miscarriages, despite previous reproductive difficulties and failed treatment. Through various programs, Gabriela and her team has educated over 140,000 couples in more than 110 countries. She's an expert, y'all. She's also the host of the Talk Sex with Gabriela Rosa podcast. I love that. Your podcast is about talking sex because guess what? Sex leads to fertility. I like it.
That's pretty much it. We had to do it because I had so many patients who are like, I really want to have a baby, but I don't want to have sex. And I'm like, okay, we need to talk about that.
Even though you can, also the new thing is I want to have sex. I don't have a man. I mean, I want to have a baby. I don't have a man. So I'm gonna go to the sperm bank. So yeah, technically you don't have to have sex, but usually the preferred way is to, have to have sex. So I love the fact that your podcast is talking sex. All right. So I'm gonna start off with a label. And the label is, what are you defining as female infertility?
I think that's a really great question. And to answer that, I think we need to look at infertility itself first and foremost. So, infertility is defined as 12 months of unprotected intercourse and no baby. Okay. So, I never actually define female infertility because infertility is a couple's issue.
Mm.
So I think that that's the first thing that we need to understand because 40% of infertility is due to female factors, 40% is due to male factors, and 20% is due to environmental, idiosyncratic, embryonic factors. Okay. So, what ends up happening is that the things that we do in our day to day lifestyle will impact the quality of the egg and the quality of the sperm. And then, of course, consequently, whether we are going to end up with a baby at the end of this entire process and journey or not. Okay. So, part of what falls under the umbrella of female infertility is going to be things like blocked fallopian tubes, ovulation issues, egg quality issues, for lack of a better, kind of way to describe it. Excuse me. And, of course, uterine function and or dysfunction, right? So in that there are endometriosis, fibroids, endometritis, adenomyosis, like you name it. There's lots of uterine and lining issues that can also prevent implantation from occurring, which is, in order to have a baby, we have to have an egg and a sperm that meet. When they meet, hopefully, the sperm will be able to get inside the egg and that egg will become fertilized. Once the egg is fertilized, we have an embryo. Once we have an embryo, that embryo has to implant in the uterine wall, in the lining of the uterus, so that essentially it can start the placentation process, which is the embryo drives, and so does the external environment to the embryo, drive the placentation process so that a pregnancy can be maintained successfully to 40 weeks. And, in other words, to term, 9 months of pregnancy. And so basically, that is an entire process upon which every single one of those steps may succeed or fail. So we can see that when we talk about, fertility, miscarriages being a female issue, well, actually it isn't, because the reasons as to why fertilization doesn't happen is driven by sperm in many ways. The reason why implantation failure fails is also in some ways driven by sperm and the uterine environment and the embryo. So there's three kind of components to that. And then, of course, whether a miscarriage happens or not is also to do with the quality of the sperm within that entire context. So, fertility very much is a team sport. And so that's how we need to conceptualize it, because the second that we try to kind of segregate it to one part of that entire fertility equation, we are leaving a lot to chance. We're leaving a lot to be desired in terms of the results that we want to create and achieve. So ultimately, that's why I think that, when we are labeling fertility challenges, we need to be really conscious of the fact that it does take two and actually three to create a baby.
I love that. I love that. Not what I expected. With the only part of that introduction that I expected was the 1 year thing, because everybody knows that if you've been trying for 1 year and not seeing results, then you are infertile. But everything else that came after that was new to me. Well, not 100% of it. But I like one of the things that stood out from what you just said is that the man, I mean, okay. So a couple days ago, I was having a conversation with my doctor about geriatric eggs. I mean, and I was telling him that, he was telling me that his wife just got pregnant. They've only been married for 13 months and she's 8 months pregnant. So which tells me that they got married and boom, boom, she got pregnant like in 2 months. And then he tells me she's 37. And I'm thinking, oh my gosh, I never heard that because I read this book once where the girl was saying that she went into a fertility specialist and it was a female star. I don't remember her name right now. Rebel Wilson, actually. And she was saying that at 36 or something, or 37. However, she was in that ballpark and they were telling her that she has geriatric eggs. So I was telling my doctor and he agreed with me that, after 35, your eggs are geriatric. And usually that's what we blame infertility on. But you just said something about the quality of the sperm. in fertilization, the quality of the sperm and implantation. And I mentioned to you before we started the recording that I've had several people on the show or specialists on the show talk about infertility, and nobody has ever touched but the men issue. So let's broaden that. Why is it? Well, we know the quality of the. Let's talk about the quality of sperms. We always hear, and everybody probably knows, that if all right, you're not pregnant, they go test to see if the guy has got enough sperm because they need 1 million sperm or something from one egg. But what is the
More than that.
quality of the sperm you're talking about here?
Yeah. No, that 1 million would be considered low sperm count. So
You're
in
kidding.
order to
Wow.
have, yeah, so in order to have a normal sperm count, we would need at least 20 million
Oh my
sperm
God.
in the sample. So it's not insignificant. But here's the thing that I think a lot of times we don't realize is that there are things that are general semen analysis kind of workup will identify, and there are other things that it will not. Okay. So male fertility, like female fertility, declines with age. And we often don't hear that either.
No.
We often are told
These
that,
men are popping out babies at 70.
exactly. So, we hear of Hugh Hefner getting a Playboy bunny
Yeah,
pregnant
I know,
at
right?
the age of 90, and we kind of go like, oh, every man can do that. Well, you see, there is some differential concerns here that we need to take into account. A Playboy bunny is probably in her 20s, if not
Right,
earlier,
right,
right?
right.
And so the energy production within the egg and its ability to correct the DNA fragmentation, the errors in the sperm of an older male when a woman is younger and its fertility potential of that egg is much, much greater, is very, very different to a 35 plus woman. Let's say, if I would even say that, there is a very, in my opinion, incorrect labeling of female eggs, geriatric eggs being, anything above
One of
35,
them,
30,
right? Yes.
whatever, right? I don't know. I don't like that because you see, there's not much you can do about age. And so a very reserve, yes, it does decline with age. But the reality is that age is a proxy marker of other biochemical factors that change in the system with time because of generally how we actually live life, the exposures that we have, the length of time we've been exposed to toxins and, a whole bunch of things that will decrease the quality of the egg. So you can have a certain ovarian reserve, but you can improve egg quality. And so, whereas you can't increase the number of eggs that a woman has. So, although it is true to say that our egg reserve, ovarian reserve, declines with time. And yes, the ovarian reserve of a 40-year-old is substantially different to a 20-year-old. The difference between, for the most part, there are some sharp declines around that 35, 37, or 38, 40, and 43 mark that actually is significant. But what we also need to take into account is that if we are only looking at the egg, and we are not taking into consideration the fact that sperm is being produced all the time, whereas women, we are born with all the eggs that we'll ever have. And so what happens is that we can very much improve the quality of the sperm that's being produced by lifestyle factors, right?
Mm.
By removing alcohol, removing smoking, removing, recreational substances, sorry. All of those things are going to decrease the amount that the body has to process to create healthier cells. Okay.
Mm.
And some of those exposures, they have a direct effect on the cells that produce sperm, the Leydig cells. And so therefore, if there, for example, smoking is one of those, alcohol is one of those that will have a direct impact on the cells that produce and can damage the cells that produce sperm. So by
Mm-hmm.
avoiding those toxins, what happens is that we are improving cell regeneration potential, which as in turn helps to improve sperm quality development. Okay. So
So let me
those
ask you,
things,
let me ask you a question right here. So if a woman has, we're going to keep that label, even though it's probably not right, geriatric eggs, and a man has good quality sperm, does that increase her chances of fertility?
Yes. And if a man
Okay.
is younger, also,
Okay.
because he has less DNA errors than older man
Okay.
with the
Sorry.
same
Go
or
ahead
similar
then.
sperm. So the opposite is also true. So when
Okay.
couples are usually paired in age at the same age, their chances combined is less than if you have the opposite pairing, which is older woman with younger
Younger man.
man, or vice versa.
Mm.
You see?
Wow.
And
Okay.
so that's definitely going to make a difference. And that's also part of why, in nature, you see these kinds of pairings sometimes where you have, an older man, younger woman kind of situation that goes on. These
Mhm.
days, we're seeing the opposite, certainly a whole lot more.
Yeah,
Um,
yeah, yeah.
you know,
The older woman can't get pregnant, so that doesn't, I mean, the older man, younger woman, that's great, but it doesn't work the opposite way because,
Well,
you
it
know,
does work the opposite way to an extent.
it's an extent,
So,
right?
to an extent. So, basically, a woman who's 40 will have a better chance of taking home a healthy baby with a man who's 20
Right.
versus a man who's 40.
It's 40, right, right.
Okay.
Yes, yes.
So,
But when
it
she gets to
does.
45 and 50, it's like dropped off.
Oh, look, there is absolutely when you hit a ovarian reserve, depletion, you are
Yeah,
definitely going to have, a situation where you have no more eggs and therefore menopause starts.
right,
And
right, right,
so that really is the fact that we need to take into account here is that females have a biological limit in terms
right,
of how long they can continue trying to have a baby, whereas man doesn't have that biological limit, even though the chances are smaller
right.
over
It's
time.
decreased.
Okay,
Right, right, right.
exactly. So
I love
that's something
that.
that we do need to take into account. But, the reality of it is that, again, if we look at the things that will improve the chances for any woman is definitely going to be by looking at, okay, how can we optimize sperm quality? Okay. And sperm quality, going back to the things that you will have done on a standard semen analysis, you will have count, motility, and morphology. How are they swimming? How are they shaped? So if we have low count, low motility, low morphology, it's possible and very likely that we also have DNA fragmentation issues, more DNA errors within the sperm, which can happen because of various factors, including environmental as well as infections, as well as, you name it. So, what happens is that if we have a semen analysis with parameters that aren't ideal, it's not enough to say we need more treatment in terms of the female. IVF is the only option. No, we need to understand, okay, because now IVF used to be used only for women who had blocked fallopian tubes. Now it's also used for in couples where men's sperm parameters are a problem. The issue
Mm-hmm.
with that is that it increases the risk of miscarriage because then you're creating embryos that have already predispositions toward
Mm.
not developing in the healthiest possible way that it can. And depending on the
Mm.
reasons as to why the sperm quality is affected, let's say, for example, if it is an infection that's silent and hasn't been picked up, well, the chances of miscarriage increase drastically, you see. And so it doesn't, like when you only do a semen analysis to look at count, motility, and morphology, you're not looking at silent infections, anti-sperm antibodies, DNA fragmentation, which are all additional tests that are not requested through standard workups, right? So you'd have to be infertile for a long time with lots of other factors that are getting in the way, or seeing a urologist who typically will dive a little bit deeper than a
Wow.
normal IVF doctor for men's fertility. And so to be able to actually start looking at that and understanding. Now, I'll give you an example in real life of a couple of mine who were infertile for 14 years.
Wow.
And by the time they came to me, they had, the first 8 years, they were just using no contraception. So they were just trying, seeing how it went. After those 8 years, they decided, okay, you know what, we better kind of get serious now. Let's start fertility treatment. And so at that point, they went through 6 IUI cycles that didn't work, 2 IVF cycles that also failed. By then, they've spent another 6 years trying to get pregnant, and that was when they found us. And so
Now
basically,
that's what you call commitment. My goodness. Wow.
look, I tell you, the length of infertility of my patients in my clinic is on average 4 years.
Okay.
And we know this because part of my master's thesis at Harvard for my master's in public health was actually looking at exactly our success rates, what it is, who were the people that we were serving, and so on. And we
Mhm.
found that on average, people were infertile for 4 years, plus or minus about 2.5. And many of them, almost 50%, had experienced previously failed IVF cycles, with 51.5% having had previous miscarriages, which dropped after treatment to 13.5%. And the overall live birth rate was 78.8%. And the cohort size was 544 patients. So the thing about it is that there are ways to improve and optimize all of these things. It's just that often, again, through standard therapy, the only avenue is you've been infertile or trying to get pregnant without success for 12 months. Here, go and do IVF.
Mhm.
About 80% of it started IVF cycles actually don't yield a live birth.
I
So
know.
imagine when you have, literally an 80% failure rate on a treatment and it continues to be this golden standard, right?
Wow.
It's
Yeah.
it's pretty it's
Yes.
significant, for a lot of people.
Yeah.
And,
Yeah.
especially when you account for the fact that one IVF cycle on average costs between 15 to 30,000 US dollars,
Right.
on
Right.
average.
Yeah.
So
Well,
it's not a cheap process.
as you were talking, I remembered a story, and I definitely will share this episode to this person because they obviously were not giving the information that you were talking about here right now. We have a family friend that was infertile for, I would say, 10 years. I mean, they've been trying for a while. And then she decided to do IVF. She's 36 or something. She's not very old. They decided to do IVF. She borrowed the money to do the IVF, succeeded in twins, implantation of twins,
Mm.
and then both of the babies died. So as
Oh.
you were talking, I'm thinking that, the fertility specialist missed maybe something from the man, missed something about the DNA. Does that sound like, or
Look, there
that's
are so
normal
many.
stuff?
No, I wouldn't say that a baby dying is normal, especially, like, I mean, obviously twin pregnancies have a higher risk of compromised outcomes. But at the end of the day, it's hard to know in retrospect what didn't work, right? I mean,
Mm,
it's very easy to kind of go, oh, it could have been this, it could have been that. But the reality
mm,
is that each person is different and how their body responds to certain things is going to also differ. The way that I like to explain this is like, we all know people who have never smoked a day in their life and died of lung
get loves the
cancer.
cancer. True,
And
true,
then other
true.
people who
Right,
literally have been chain smokers and never developed cancer at all. And
right.
that's because of
Very true.
epigenetics.
Right, right.
One exposure can affect different people differently. And so in her situation, it may not have been any of these factors. It may have been something completely different. And it could have been
Mm,
pregnancy derived. It could have been, exposure derived. Like who knows, right? So it's
right.
hard to kind of
Okay,
pinpoint retrospectively what actually went on.
okay.
But going back to this couple that I was telling you about in terms of sperm parameters, because one of the things that we found was that he had very, very poor and low sperm count. He had only 2 million sperm. And, after 14 years, you would have thought that there would have been a very comprehensive workup to figure out
Yeah,
why do we have such low sperm, but no,
yeah.
there wasn't.
Or that's what I'm
And
saying.
yeah.
These fertility specialists probably only focus on the women's eggs. That's probably what they do.
And that is not, this is where you've hit it on the head. You've nailed it because that is what typically is done. It's like focus solely on the woman, on the woman's egg. woman's age, and basically based on that makes an assumption. And this couple, what was interesting about them is because obviously we're asking much deeper questions and we're going much further into understanding, but why is the count so low when we don't have varicocele, we don't have, any other kind of like impediments that we can easily see, but we had lots of missing tests. And one of the missing tests that we had was there was STI screening that hadn't been done, and there was semen culture for infections that hadn't been done. Once those things were done, we found that there was an infection in both of them that was known to cause implantation failure and miscarriage and sperm
Oh,
compromising.
oh.
And we treated it, with a lot of antibiotics. And after they were ready to start trying again, they conceived within the first attempt. So,
Wow.
the
It's
reality
beautiful.
is it is beautiful. And it's literally like for me, even though those stories sound like, oh my God, that sounds really complex, all of our patients have those stories. Like we treat difficult, complex cases of people who typically have done
Well,
lots of things
what I
and
get
nothing
from
has
that,
worked.
what I get from that is if you keep trying, you will succeed. I
Well,
mean, yeah, that's
the reality is that it's not if you keep trying, you will succeed. If you find the strategy of uncovering the problems that are getting in
problem.
the
Right,
way
right. Okay.
and you do the work, you can succeed.
Succeed. Okay.
That's the thing that, because trying on its own, it's like not every change is an improvement, you see.
Mm.
So a lot of times what people think is like, okay, I've tried this treatment,
Hmm.
it hasn't worked, so I'm going to change clinics and I'm going to do the same thing in a different clinic,
Clinic.
right?
Right,
And
right.
then they've kind of, that didn't work. They go and find another clinic. And it's like, well, you can change clinics as much as you want, but if you stay within the same paradigm and you're still looking for the same way to solve that problem, you are going to be getting more of the same result. Einstein did say that that was the definition of insanity,
Right,
doing the
right.
same thing and expecting a different result. But that's what
Mhm.
most people the it's the sunk cost fallacy. It's a cognitive distortion that basically tells us, well, I've already invested so much time, effort, energy, money into this. I have to keep going because if I keep going, I will have a baby. And it's like, well,
Yeah,
actually, no, you will lose more money
yeah,
and you may not end up with a baby.
yeah.
So, this is where it becomes really challenging for a lot of people in
Mhm.
thinking that they're making a change and that any change is an improvement when actually that's not the case in practical terms. The
Right,
only way to see is that change and improvement is do we have a baby or do we not? You see,
right.
because at any
Right.
point where we have a sperm and an egg together, we should end up with a baby. If that is
Yeah.
not the case, we need to ask, but what is happening here?
What is happening?
What's getting in the
Yes.
way? Why is this not working?
Wow, that's good. Did you ever watch the Netflix documentary about infertility? And they followed about six couples. Some of them spent $250,000. The main person in the series wanted to carry a baby, and she went through the whole gamut in IVF. She got her sister's eggs. She went through the whole thing. In the end, they started trying to purchase fetuses that are already, fetuses to implant. Anyway, they went through the whole thing, and so basically, what the message of the movie was is that if IVF doesn't work, you can do these other things. You can adopt. You can whatever. So they want a baby in any way. So is that basically how what you tell your patients, or that everybody
Look,
wants to carry a baby?
yeah, see, it's a very good question. And you see, having a baby is a very personal experience, right? And for some people, values and preferences in how to achieve conception and keep a healthy pregnancy to term and deliver a baby really matters. Some people are like, you know what? I don't care how I have a baby, I just want a baby. Those are in my opinion, and they have all the time, energy, effort, like money allocation to doing
Right.
that.
Hmm.
Those are my favorite cases because it's like I know that we will. literally decision analyze the situation, figure out what is the best path to baby, because it's not always go and do IVF, go and do like, some people actually need a donor egg or a donor embryo with a surrogate. That's what they
Right,
need
right,
because they have
exactly.
medical issues that
Right.
are precluding a natural conception. But
Mhm.
some people are not ready for such,
Right.
how do you say, such scaling of their fertility journey. They want to take it a little bit more step by step. They might want to optimize things and try naturally for a period of time so that they can feel like they've done everything they could. If that
Mhm.
doesn't work, then they might try IUI, IVF. Then, if that doesn't work, they might decide, okay, you know what, donor egg or donor embryo or, whatever
Right.
other option is
Mhm.
available to them. We have to take into consideration that every step that one takes on the fertility journey is a cost.
Yes.
Physical, emotional, financial, relational, you know,
Mhm.
decision making, bandwidth, mental health, all
Mhm.
of those things have a cost associated to them. So some people are of the idea that, well, if I try for a period of time and I don't conceive, that's it. I'm just going to go live my life in a different way. Some people are much more attached to, I need to have a baby, and no matter what happens in my life, I will not go through this existence without one.
Mhm.
Those are different people. Okay. They are different. They are different in what they are willing to do, how they're willing to get there. There's a whole lot of differences that apply to those types of different mindsets. And there are
Mhm.
people who the journey itself dictates what ends up happening. There are some people who I met through my 24 years of, treating patients who come to me and they're like, you know what? I will never do donor egg. And then we rule out every other possible thing. And they're like, you know what? I want a baby more than I want to wait to have a baby. So I'm going to go and do donor egg.
Yeah,
And then there
yeah,
are people who
yeah.
are like, you know what? I'm ready for donor egg. And we assess the case. And I'm like, maybe you could try naturally for a period of time and conceive naturally, after they've been told that they never would. So it values and preferences really matters because how somebody comes into the journey, their mindset, the way in which they operate, how they're working through their issues, physical, emotional, relational, financial, etc., will also matter. Not every person has equal access when it comes to fertility treatment as well. And I think
Right,
that
of
that's a
course.
really important thing to, highlight because there are certain countries in the world where the government will fund as many IVF cycles as you require to have a baby. There are others that will fund zero. There are others that may fund some. And there are others where the only option is paying privately for whatever cycle you want to have,
Mhm.
which really precludes an entire proportion of the population from ever accessing that kind of treatment anyway, because who has 30,000 US dollars to invest on, when an average household in the United States earns under 60,000 a
Right,
year,
right.
right? That's half of a year's income for an
Yeah,
average person.
yeah.
So it becomes one of those things that you almost have to decide, can I afford to have a baby?
Right, right.
And with that same question, it's like
And
if you can't
right,
afford fertility treatment, can you afford a child?
right. But also that the $30,000, I think statistically, it's very rare that it happens after the first try. I mean, people are
Precisely.
going through five, six, seven,
On
eight.
average, exactly. On average, it's an eight
Yes.
cycle journey to a close to 80% live birth rate on average.
Right, right,
So
right,
it's very uncommon. And, we hear the success rates of IVF and we hear about the success stories. The reality is that it's not that good,
no,
you
I
know?
know. I know, which is
It just
basically what this movie was trying to show you, that it's not that good. People are just keep going through and going through and going through, and it's absolutely amazing. So, wow, very, very great conversation. I don't know why I'm so interested in this topic, but I've been very interested in this topic.
maybe another baby's in your future. Who knows?
I don't know. There's no babies in my future, but I find the topic very interesting. So, okay, so the subject line that I wanted for our conversation today are, what are the top causes of female infertility? Now, you just highlighted what are the causes of male, we want to call them infertility, but quality of their sperm being diminished. But what exactly happens to make a woman have these issues with whether, we don't even need to go on to the quality of her eggs because everybody knows that. What else is there?
Sure. No, I think that's a really good point. I mean, obviously, ovulation dysfunction is going to be one of the, like, let's say all things being equal, and a woman is of normal reproductive age and expected to be able to have a baby and it's not happening. Well, then we need to check certain parameters. We need to check, do we have a uterus that can host a baby in a pregnancy? Because sometimes deformities in the uterus and misshapen uteruses can occur and can decrease the chances. So if you do have a kind of malformation of the uterus in some way, sometimes you can be fixing that with surgery, sometimes you cannot. Okay. So it just depends on what's going on there. But certainly we would be looking at the anatomy of the uterus or the shape of the uterus. We would be looking at the lining of the uterus. And things that affect the lining could be, like I said before, endometriosis, adenomyosis, fibroids, there's lots of things. And endometritis, so infections, inflammation, there's lots of these different types of things that can in fact impact the lining of the uterus. And of course, that impact will cause either anatomical distortion, which is like, if the shape, for example, let's say you have a fibroid inside the uterus and it shapes the uterus in a certain way that doesn't enable the passing of the sperm through to the fallopian
Mm,
tubes and through to the
okay.
to the egg. Or
Mm,
if implantation happens, it's kind of pushing that potential embryo outside of the place where it can implant.
okay.
All of those things can actually increase the risk of miscarriage and implantation failure. So those are the kind of big reasons as to why a woman at reproductive age will have difficulty. Then, of course, there are fallopian tube issues, So if we have fallopian tubes that are either blocked, damaged, you know, you name it, there's different aspects that can happen with it. Infections can sometimes, like sexually transmitted infections can sometimes create issues. And even after they've been treated, they can have damaged the cilia, the hairs in the fallopian tube, which then stop the egg from being able to travel through for
Mm,
implantation to occur. So then damaged fallopian tubes also becomes an issue. So those are the main kind of big categories, of reasons as to why women, outside of course, age and age-related factors, that women would actually have issues in terms of, being able to conceive and keep a healthy pregnancy to term. The big issue here is that unless there are some big visible problems, there are other aspects that I didn't talk about that can also impact that whole balance of the ability to keep a healthy pregnancy to term. And that's more to do with autoimmune and immune mediated issues, So there's just different conditions that can happen, antiphospholipid antibodies, ANA. So, there's lots of different types of natural killer cells, lots of different types of immune mediated issues that just because the sperm is a foreign object as far as the woman's body
mm.
is
Oh,
concerned, and
really?
so is the
Wow.
embryo.
I
The
did
embryo
not
is a
know that.
foreign. Yeah. And so the immune system can sometimes mount a response to the embryo itself simply because, well, it is external. It's not part of the woman, right? There is a symbiosis that can happen, and obviously it happens enough that we have a growing population.
Right.
But
Wow.
but it's certainly, those are areas as well that when people are having difficulty keeping a healthy pregnancy to term, those are areas to take into account as well, for sure. So
Okay.
there's lots of varieties of um how these things play together, that may, and sometimes what can happen is that many of those issues can coexist in the same female
Right, right, right.
or in the same couple.
Yeah, I heard about the autoimmune and I didn't understand what that meant, but my daughter has a friend that was trying for a long time to have a baby, and she had this autoimmune thing that was eating up the kid, and then they gave her some drugs for it, and then she was pregnant for 6 months and didn't realize she had a baby and all that. But what I want to get to before we end our conversation today is the pill, because I've always blamed the pill for the fertility issues, and you didn't mention it.
Yeah, because you see, the thing about it is this. Remember how I was talking about the exposures,
Okay.
smoking affecting people differentially? It's a similar thing, right, with the pill. For some people, it will absolutely be something that will create and trigger issues in a female. I know that for me personally, when I went on the pill, I literally, my whole life, I was on the pill for 1 year. And that year that I was on the pill, and then when I came off it, I realized that it had actually triggered for me symptoms of polycystic ovarian syndrome, so PCOS, which is one of the number one causes of infertility, female infertility in women.
Wow.
And
Wow.
so it
Only
doesn't
for a
happen for every
year.
woman.
And some women stay on that thing for 20 years.
But this is the thing, it's a predisposition, you see. So that doesn't happen to every woman. Some women literally stay on the pill for 20 years. They will come off it. The next cycle, they're pregnant,
They're pregnant. Yeah.
you
We're
know.
talking about
And so
rare cases
it's
here.
one, huh?
We're talking about rare cases here.
Yeah, exactly. So, like those cases are all possible. And so, when you have a situation where you can't say there isn't enough data to say that the pill causes these
Okay.
issues.
All right.
It's associated in certain situations, and there are exacerbations for people with certain genes. There is an exacerbation of outcome in terms of results that lead to certain things, but these are associations more than, I mean, there were actually some in the 70s, 80s. There was some pills and some pill forms that basically could lead to, and there was a causative factor in terms of certain cancers, and so, but again, with people with certain predispositions, you
Mm,
see. And
okay.
so depending on the individual, and that's why it's going to be really important, is that should everybody be on the pill? No, there are contraindications to the pill. For women who have higher likelihood of clotting disorders, they are
Mm,
literally told this is a contraindication. You shouldn't be on the pill. Clotting disorders lead to increased risk of miscarriage and implantation failure. So you see, the combination of all of those factors can lead to an exacerbation and an increased risk of these particular issues. But we can't put, this causes that, because that would not
you
actually be
can't say
correct to
cause and
say.
effect. I like that. I like that. But
Yeah.
yeah, the women
And
should
as
be
much as,
aware of it.
as
Right.
much as in terms of preference, like I don't prefer my patients use the pill as contraception
Mm,
because of these unknowns, you see,
right.
because
Right.
we don't know how this one person versus that other person is going to react and respond. I prefer that they're not on it. But, can I say that it's going to be the cause of all problems? No, we can't.
Mm, okay. Well, I'm glad we covered it because there's, me personally, that's basically what I thought, because I started off our conversation by saying that when I was in childbearing age, 30 years ago or so, then nobody had problems of being pregnant. Now it's a totally different thing, and I was blaming the pill. But like you said, there's all these environmental issues and whatever the reasons that women are not being able to, to the egg and the sperm connect, and then the implantation, the whole thing that you walked us through. That's absolutely amazing, because a lot of people don't follow the trail or follow the purpose. I
Mm.
mean, not the
Mm.
purpose, follow the trajectory. They're just stuck at the conception part, right? Egg meets sperm, right?
Yeah, yeah.
But yeah, we didn't even get a chance to talk about miscarriages. And that's another thing. Like, why are we having miscarriages? Why is it that the fetus is not implanting? You pregnant, and then within a couple of weeks the thing just comes down. And I'm thinking that you talked about the quality of the sperm and the quality of all this other things that people don't even think about. At least I didn't. So
Yeah, no, for sure. And we can do a part two on miscarriages. There's a lot to talk about there. But what
yeah,
I do want to mention, and I think it's important to note, like environmental factors have certainly been demonstrated to negatively impact female and male fertility. One of the things that you're talking about in terms of like Is infertility more prevalent? There's several reasons as to why people are having less babies. Some of them are social, right? So literally the decision of like, you know what, do we really want to have children? Can we afford to have children? Because children are expensive. There was some
Right.
studies that show that, to raise a child to 21 in a Western society, it's over $1 million. And with inflation, it's probably more. So the reality is that there is a cost consideration, and people are having fewer children these days because of that cost consideration as well. But if we look at total numbers and absolute numbers in terms of sperm parameters and a decrease of male fertility from just purely assessing sperm parameters, we know through various studies that there has been a massive reduction, in fact, a halving of the sperm count of men because of environmental factors and environmental issues.
Mm.
So
Mm.
endocrine disruptors in the environment, the pill that women take that then end up in the pee that then the men drink through the unfiltered water that they drink. It's like, all of that and more
Yeah,
will be
yeah.
affecting, the way
Wow.
in which fertility is impacted, over time, certainly in most societies. But yeah, it's a huge issue. Certainly
Yes.
today, 1 in 6 couples is infertile.
Oh my
Millions of
goodness.
people are affected, and
Yeah.
it's still in the general population, the grand scheme of things, it's still very much a minority. And that's why a lot of times when patients are having fertility challenges, the system, the healthcare system doesn't actually support them, doesn't help them.
Mm.
Because what happens is the majority of people conceive without trying. So why are we going to put all of this money into helping people who are having difficulty take home healthy babies when we actually have plenty of babies
Plenty of
overall?
babies, right, right.
You know,
But
and so
it's
it's a big
yeah,
challenge.
yeah. It's all perception now because where I sit, most people that are trying to get pregnant are having difficulties. I have rarely found, in fact, if I go back to all my data, there's only one person I know that just keep popping out babies. And that's because she does never want to be on the pill. So she
And
just keep popping
sometimes,
out the babies. She's the
yeah,
only person I know. Everybody else having an issue.
yeah, 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 yeah. And sometimes, people like that, they just want to have more babies, you
Yeah.
know? So it's just one of those things that, there's definitely that consideration as well. So for sure.
Yeah, yeah, very good. All right, Gabriela, I can see why anybody that's listening or having fertility issues will definitely want to talk to you. You know your stuff, and you've convinced me, so that's amazing. So tell our listeners about the Rosa Institute and your treatment methodology and where they can find you.
Yeah, sure. So we help couples overcome infertility, recurrent miscarriage, and failed treatments. And the program, as I said before, has a 78.8% live birth rate. I do a lot of patient education on Instagram, so people can go to Gabriela Rosa Fertility, and it's Gabriela with one L. So Gabriela Rosa, and then the word fertility. They will find me on Instagram, and they can just Google that and find my website. But my website is fertilitybreakthrough.com. So fertilitybreakthrough.com is where they can find me as well.
Okay. All right. And do you want to talk about your treatment methodology, or you'll just have them contact you for that?
Oh, sure. I mean, in terms of our treatment methodology, really the fertile method is what underpins what it is that we do. So basically, fact finding is the first step. If we don't understand what we're treating, more treatment isn't the answer, right? So understanding and diagnosing the problem effectively is halfway through to a solution, really. And so then we educate. We educate our patients as to, okay, what is there that you need to know, that you need to do in order to get different results? And then we make recommendations that are very personalized for that particular situation, that particular couple. And we're looking then to treat with the intention of addressing whatever the issues in our fact finding stage that we found to really be able to understand what else needs to get in the way, be removed from the way so that they can actually have a baby. The I infertile is the incubation stage. We can't do anything about the fact that a pregnancy is 9 months. It is just how long it takes. And with that, we then need to make sure that we are definitely giving the body the time that it needs to be able to have the results that it's going to be able to achieve, right? And then finally, the liberate stage, which is where people are going to, we do work very closely with our patients to be able to really ease the emotions of the fertility journey because they can be really challenging, and throughout that stage, it's not that we leave that to last, it's just that that is a component of what we're doing throughout every stage. And then, of course, the end results that we get to, which usually is a new beginning, where we're
Yeah.
going through pregnancy, baby, and that is how we help our couples achieve the result that they're looking for.
I love it. I love it. I love it. And yeah, you talk about results. Let's get to the destination. I was listening to a YouTube video today, and the guy was talking about, hey, nobody's interested in the process. Just tell them the destination. If you're going to Hawaii, nobody cares about the plane.
Yeah,
Let's talk
yeah,
about Hawaii. So
yeah.
yeah, your destination is 78% baby. So that is amazing. So even though the process is good and the methodology is good, right? People want to say, you're gonna help me have a baby. That's what they're
Well,
looking at.
that's
That's
the
what they're gonna pay you for.
that's the game. That is the game. Baby is the name of this game. That is for sure. And like I assess cases with that in mind. Like I assess every case that comes into this clinic with the view of, are we likely to have a baby out of this situation? Because
Yes.
if we're not, then I make other recommendations of things that I think people are going to need, which is not this, because we are really looking to demonstrate clinical effectiveness, right? And so in order to do that, we've identified already the types of patients that we best serve, and all the cases that we treat are difficult and complex. But there are people who are not willing to do the work, or that are not willing to do further testing, or whatever it is. In
Mhm.
those instances, we're limited in terms of what it is that we can do. And when that's the case, then it makes no sense for us to work together.
Yeah.
Right. And
Not to take
so
their money. Right. Yes.
precisely. I might as well just, work with somebody else who's going to have a good chance, who it's going to be a service, and
Yes.
they're going to have the result that they want because that's what we want. And so, our interests are very, very aligned. And so that's the premise. That's really looking at, whereas through an IVF process, the premise isn't baby, the premise is cycles. Shareholders care about profits and number of cycles. That's
Mhm.
what's going to be most important in a context like that. And so there are misaligned interests, in the healthcare system, in the infertility, journey for a lot of people. And so that can be a real big challenge.
Yes, yes, I love it. I love it. All right. Well, listen, I really, really enjoyed my conversation with Gabriela. We started off with a bang, we ended with a bang, and we've given a lot of information. Again, the biggest takeaway that I have is that it is not just the quality of the woman's eggs, whether it's geriatric or what, but men play, she said 40%.
Mm. Yeah.
40% equal to the women, right?
Which
40%.
means a
So
50-50, like in that kind of context, it's a 50-50 equation.
50-50 occasion. But yeah, all right. So let's go get the issue with the sperm checked out before you go plop your money down on IVF treatments that doesn't work when they're not understanding the whole picture. So definitely gotta, if this is your journey, this is something that you're thinking about, definitely go, like we said in the bio, that Gabriella's clinic is nationwide, global. She
Yeah.
is in like 110 countries or something. So, yeah, get in touch with her. I'm going to have a short transcript of my conversation with Gabriela on the show page, which is myhelps.us. I will link out to her on Instagram and her website so you can have more information. Yes, hey, I can almost tell you that, yeah, this is not going to be, your money is not going to be just going down the drain, right? It's going to go to somebody that can really help you. So, Gabriela, thank you for being on the show. I enjoyed this conversation almost as if I'm looking for infertility treatments.
Well, I'm glad it was interesting and
Yeah,
informative.
because I love education and I love knowledge. And this was great. I learned a few things. So that's amazing. All right. So as we wrap up, Gabriela, do you have any last words?
Act pregnant now to get pregnant later. That is the key to success. You know, everything that you would absolutely do if you were pregnant right now, whether you're a male or a female. And I know that men have a lot of difficulty figuring out, how does it look like being pregnant? But the reality is that you are already 50% of that little baby that you want to create is within you. So the key is to nurture those cells, optimize their quality by doing all of the things that you would do if you wanted to give your baby the best possible start in life, because parenthood begins right here, right now.
Yes, I love it. I love it. Yes, give them something to do. All right, guys. Well, listen, thank you for tuning in to this week's episode of Transform Your Mind to Transform Your Life. Today, we're talking about transforming your life with a baby. So, thanks again, Gabriela, for being on the show. Thank you guys for tuning in. Until next time, namaste.
Thank you.